Pediatrics and Advocates.
Okay, thanks everybody for joining us today. And I can see that Tara Chadwell has joined. I'm not sure. Tara, can you hear us?
I can, yes.
Do you want to introduce yourself?
Sure. I'm Tara Chadwell. I'm the director of the Children's Resource Center at Niswonger Children's Hospital.
Okay, thank you everybody for joining us today. We've gotten a question about claiming CME credit. So if you go to the ETSU Project Echo website, and I think we're going to get a demonstration of this. And you can just, the way I find it is I usually just Google ETSU Project Echo, and you click this link to claim attendance for the April 24th session. And CME has started using a new system called Highmarks, and if they've not used that before, they have to create a login, but it should be pretty self-explanatory.
First and last name and email.
So first and last name and email is what's required to create a login and an account. And then that's the system that ETSU is using for CME credit from now on. So once you create that login, you'll be in the system and it'll be easy to claim credit. If you have any questions, you can call their office. It's 439-8027. That's 439-8027. So I am really happy that Dr. Kim Hale is able to join us today as our speaker and expert. She is director of the Center of Excellence in Early Childhood Learning and Development, as well as associate dean in the ETSU Plymmer College of Education. She is a super busy lady. She had a dozen years of experience working directly with children, adolescents, and families prior to coming to ETSU and joining the faculty in 2007. Her expertise is in the areas of child development and school psychology. And she has worked with our department on a number of projects, including helping work with us and one of our former residents, Dr. Jessica Tuberty, to establish a Reach Out and Read program in our clinic. And Dr. Hale still serves as the coordinator with us for that program today. So we're thrilled that she can be here today, and we're going to start off with Dr. Hale talking about promoting early childhood literacy.
Hi, everyone. They don't say hi back because they're muted.
Yes.
I'm glad you're here, and I'm excited to talk about Reach Out and Read. This is one of my favorite projects of all the things that I get to do at ETSU. This ranks as the top. First thing I need to tell you is that I or my immediate family have no financial interest in Reach Out and Read or doing anything with pediatrics. I do it out of love and wanting to make the world a better place. So I'm going to talk with you about, oh, you want me to do this? Got it. Okay. So today, by the time we finish, I want you to know the main components of a Reach Out and Read clinic. We'll talk about how you can apply to become a Reach Out and Read clinic. And I'm going to give you a few cues about how to engage families around early language and early literacy development. I'm convinced that healthcare providers and pediatricians have a unique platform to be able to do this. And I'll tell you a little bit about how to create a literacy-rich environment in your waiting room. And then we have cases to discuss at the end, and of course I encourage a lot of questions and discussion. We have been a Reach Out and Read site at ETSU Peds since 2008, and we've had bumps in the road and struggles and really strong times, and we can tell you all about that. So you all know that there's tons of evidence talking about the first years of life and how important those are in setting the stage for development. As a school psychologist, it was very difficult for me to remediate the cultural deprivation that my children had incurred before they got to me. And that's how I got involved in really looking at ways to improve parenting and early environments. We know that the more that families do with their children, the more that they talk with their children, the more stimulation they have at home, the better off children are, and they go on to become healthy adults and working adults and contributing to society. So this whole idea of positive and responsive parenting and the contribution to healthy development is a biggie. And you as physicians are in a great place in life to make that happen. I don't know if we talk very much about what responsive parenting is, so I want to give you like 4 points to think about, and to think about this as you are involved in anticipatory guidance with parents. What we want parents to do is to have verbal scaffolding, and that is being able to adapt their language to meet the children's needs. We see this naturally with moms when they use the motherese and the higher talk and the shorter words, but we want that to go on. When you see parents that give children, 5 things to do in a span of 30 seconds, you know that that's not scaffolding verbally. So you want to model for parents ways to interact with a child at that child's developmental level. You also want to encourage children to respond verbally and non-verbally, so that imitation back and forth, really that reciprocity. Lots of parents don't know how to do that. And then just positive regard, having a lot of warmth, affirmations, encouragement, praise, and not engaging in a lot of criticism and negativity. And I think that the few minutes that you have during anticipatory guidance and that well child visit, you have the opportunity to model that. If you're on your game and you go in knowing these things are important for me to model, because parents do not get that in many other places. So we know that kids come to kindergarten and they're not prepared. I saw lots of this. I worked in Southwestern Virginia in public school, and there was a lot of deprivation, a lot of toxic stress, a lot of poverty, and children came to school and they really weren't ready to start learning where we thought that they should. Most of the time it was adult problems, but they were caught up in the midst of that. So a big issue was, and still is, how do we overcome that? Pre-K and universal pre-K and preschool are not guaranteed in this country. They're not provided. So many children do not have an organized avenue to learn besides parents. So when they come to see you, they get to see you more than a lot of other regular people in their life. You have the greatest access to families with young children. And we know about 91% of kids under 6 go to the doctor at least once a year, immunizations, vaccinations. That's why you have a great platform, because you're seeing children that maybe are not in organized care. They're not with a teacher that's helping parents learn about development. They may only have you as an expert. I also know that people pay attention to what the doctor tells them. They may not do it, but they do pay attention, and they know that they need to follow the advice. So doctors are held in very high esteem. And whenever you can encourage and model, you're helping to make a difference. So Reach Out and Read capitalizes on that. You're seizing the moments that you have in anticipatory care to help parents improve their parenting and to also improve language and literacy development. So what Reach Out and Read does, it's a nonprofit. It started in the late 1980s in Boston, and a couple of pediatricians discovered if they brought books into the waiting room that they disappeared and went home with children, and how many of their families were not engaged in reading or looking at books or having books. And so they began this adventure of providing and studying what happens when a pediatrician provides encouragement for language and literacy development. So Reach Out and Read will provide training for providers about how to talk with parents about language and literacy development from the ages of 6 months through 5 years. There is a requirement that you have a literacy-rich waiting room, that you will provide books for children to take home, and culturally and developmentally appropriate books, and that you will prescribe book reading and book sharing. Notice I haven't used the word reading, and that's purposeful on my part. We here at ETSU work with many families who view themselves as having a low rate of literacy, and I have found that when we use the word reading, it is intimidating to them. When we say, look at a book with your child or share a book, it's more likely that they approach that with an open mind instead of putting the book on the shelf and thinking to themselves, I'm not really a reader, and so that's not something I can do. So if you're interested in being a Reach Out and Read site, those are the things you need to do, and I'm going to talk about those a little bit more in depth, I think. Brian, it's not going. There. So to incorporate those books into your pediatric care, you would be talking with parents about sharing books. And we're talking about with infants, toddlers, and preschoolers. Reach Out and Read will provide you with developmental milestones of what you can expect with regard to language development and literacy development at different ages. And so it's easy to talk to parents about what their child is doing and aim for what their child will do next. It really can be incorporated very easily into your conversations with parents and all the things that you need to do for anticipatory guidance. You can demonstrate with a book of how to look at pictures and talk about pictures and tell stories. You can gain a lot of knowledge about a child by doing this during the visit and modeling for parents. I find that many parents think that reading a book means having their toddler sit beside of them, start at page 1, and the child has to sit until they get to the last page of the book. And parents will complain to me and say, you know, Kim, he's not interested in the book. He won't sit still. He won't pay attention. There's no use in doing that. And I try to encourage parents that even if you look at 2 pages in the middle of the book and talk about the pictures or talk about the stories, you are making an impact on that child's cognition, their ability to understand concepts. You're contributing to their understanding of language. And we know that all of those things contribute to their success in school. There's also an emotional component to sharing that time together. I encourage parents to have children sit on their lap, to cuddle, to use it as a loving time, to build attachment, to make it a routine at home, something for the child to look forward to. It's a time for families to stop the busyness and really pay attention. It goes back to that responsive parenting. And giving a new book to a child to take home for keeps is a big deal. Lots of our children and families do not have books. They can't afford books. Here in Tennessee, we have the Dolly Parton Imagination Library, but I also know from my friends who work in early intervention that many families get that new book in the mail and they're not really sure what to do with it, and it's new and they do not want their child to tear it up, and they put it on the shelf. So you providing that to a family as a gift with encouragement to use it, I think is a big plus. In your waiting room, the need for gently used books is a biggie. It's important for families to see that you and your practice want to promote reading for all people, all members of the family, not just for children. So at ETSU Peds, we've had chapter books in the waiting room as well. The idea is for people to pick up a book and read it with their child, look at it with their child, or just for themselves. And you know what? If they walk out the door with it, it's okay. That's really the point of having those books in the waiting room. Now, I will tell you that carting lots of books in and putting them on the shelf and then seeing them disappear a week later sometimes gets a little bit feeling defeated because you think, oh no, I have to do it again. But that's really the point. We've also been fortunate at times, because we have students at ETSU who will volunteer to read in the waiting room. And for students that have worked with me, we have modeled techniques of how to share books and how to ask questions that are open-ended. We've even learned dialogic reading strategies, which is a research-based, highly interactive method of getting children to talk about books. We have information about literacy programs in the waiting room, about the public library, about English as second language programs, adult literacy courses. You'll see I have a picture in here that shows, I think it's next, yes, this is our waiting room a long time ago, Dr. Schistina will remember, and that's actually Dr. Phil Rowe, who is a state senator, reading in our waiting room. But you can see we had a very colorful bookshelf behind him that had books accessible to the younger children as well as the older teenagers. And we had bulletin boards that had characters from storybooks. That was a lot of A Cat in the Hat. We had developmental milestones posted, just trying to make it attractive and eye-catching and really promote to anyone in the waiting room that we valued literacy and reading and working with children. I understand that our clinic is being revamped, so we'll have new pictures in the next 9 or 10 months, we hope. Reach Out and Read has a big evidence base behind it. I think at this point there are 15 peer-reviewed published studies showing that the Reach Out and Read model makes a difference. It makes a difference in parent behaviors and parent attitudes. There are lots of studies showing that moms and dads who get books and the counseling and advice from a doctor are more likely to share a book with their child. They're more likely to bring books home. In fact, some studies are saying that they're twice as likely to do that compared to a parent who is not engaged in a Reach Out and Read program. All of those studies are on the Reach Out and Read website, and they're easy to access, and they have summaries as well as a link to the PDF. So we also know that with regard to the language skills, and this is what's exciting to me, children who participate in a Reach Out and Read program gain language skills faster than children who do not. And that's been shown over and over again, even with children who are learning English as a second language. The reason this is so exciting to me is that our biggest obstacle in early childhood as far as pre-K to third grade is not just teaching a child to read, but getting them to the point of understanding what they read. And when children grow up in poverty or a lot of toxic stress, and they really have deprivation in their exposure to the world, they do not understand language and concepts. So I could teach many children how to read as far as word calling and sounding out words and understanding the symbols of the English language associated with the sounds. But getting them to understand what they were reading was really hard if they did not have the background knowledge. For example, the children that I worked with in an inner city situation knew nothing about stamps, putting stamps on letters. They did not understand the use of a checkbook and paying bills. They did not know really what a newspaper was or what a newspaper was for. So it was very hard when they got into third and fourth grade and began reading on their own to understand the concepts of what they were reading, because much of what they were reading did not relate to their day-to-day life, and they were very limited in their knowledge of the real world. So if you can help us as educators to improve the language skills of young children and build those synapses and connections in that brain before they get to me, even at pre-K, that will make a huge difference. And this is probably the one thing that my teachers, when I tell them about Reach Out and Read, they get so excited that doctors are teaming and helping. Also, the parents who participate in a Reach Out and Read model are more likely to rate the pediatrician as helpful. This idea of actually modeling this responsive give and take with a child and encouraging a parent to pay attention to a child's cues and verbalizations and words, encouraging a parent to put a child on their lap and to look at a picture together and talk about a story rather than the forced reading page after page, really is helpful to parents. And it's something that they feel supported on, And so often they don't feel supported. Life is stressful. They're always behind. They don't feel like they're doing everything as well as they should. And to have a person really take time to give them tips about simple interactions is rated very high by parents. Pediatricians who have Reach Out and Read are also seen as being strongly committed to the community, to really caring about the educational outcomes of children and not just the health of a child that's in their clinic. And also parents perceive that advice and the gift as really important and really promoting a habit, the routine of looking at a book and reading. So those are all positive things that have come out of studies with Reach Out and Read models. And of course, you all know that the American Academy of Pediatrics recommends advising parents to read with their children, to provide and talk about developmentally appropriate reading activities, to have developmentally appropriate books, to support and promote ways of having these options available in your clinic, and then working with other advocates like educators like me to influence our national messaging and policies. So if you want to apply to be a Reach Out and Read site, simply go to reachoutandread.org and you can find an application site there. Before you download the application, you will want to see if you have someone in your clinic who is a medical consultant. This is the person who's really going to be the champion of making sure that everyone has training, that they carry out the Reach Out and Read mission in their anticipatory guidance. Sometimes it's hard to do this when you are battling flu or ear infections. It's just something to keep in mind. And then you also need a program coordinator, which is my role. And I try to keep up with the number of well child visits and complete the progress reports every 6 months, help Karen with writing grants to get books, holding book drives, getting volunteers into the waiting room, looking at the bulletin boards, looking at our space. How could we encourage more literacy environments, activities in the waiting room? You'll also need to look at your budget for a book supply, and Reach Out and Read recommends that you take your well child visit number and just multiply that by the cost of a book of about $275 and figure out for a year what you will need. And you'll need a letter of support and commitment to having resources available to be able to provide those books. And that's probably one of the biggest challenges, because it's an extra step and it's something that we're invested in doing. The application link is there. You can find it easily, and you can complete the application online. They will tell you when you are about ready to be activated, and then you'll have to do the online training for CME credit. And then you are ready to go. Sometimes Reach Out and Read, the national organization, will have enough funds that they will send you a surprise shipment of books. If you are a very engaged site, as we are, and you're giving out lots of books, we find that Reach Out and Read gives us more books because they see that we are committed to their mission. So I would encourage you to keep that in mind. It's not a situation where Reach Out and Read sends you books when you don't have any and you're not doing well. You really have to show you're invested. So reachoutandread.org, it's a great thing to do. It's relatively easy for the impact that you get. And please reach out to us if you start this process and you have questions. I'd be glad to help. And then, do you have, we can put those slides up?
Yeah, so we have a couple cases that we'll discuss, but while we're getting those loaded, does anybody have any questions or comments for Dr. Hale?
I think one question that I was going to throw out was maybe you all could talk some about just the practical, maybe a few of the big practical challenges that you've had implementing this and how you've been able to kind of creatively overcome those. I think a big one is just getting maybe enough books to keep the supply up, but maybe you could talk about that, but also just any other challenges that you've come across and how you've addressed them.
Yeah, so that's a good question, Matthew. When we started the Reach Out and Read program in 2008, there was funding available to the National Reach Out and Read site from the Department of Ed because of the evidence that had been shown that it made a difference in early literacy. So we were getting shipments of books pretty regularly. And then we were able to, I secured a couple of Target grants. We went out to Rotary, Junior League, other civic groups, retired teachers. Sometimes I can just make a plea to teachers who are on campus in the summer for a training that if they have books in their classroom that they feel are gently used and they're getting new books, if they would like to gift those to the clinic, we would be happy to take them. We also have had ads in the newspaper for people to drop off books, especially gently used books. We've had book drives at some of the sporting events at ETSU in years past. When we played Mercer University, they're the Mercer Bears, and they were allowed to bring a book and get money off their ticket or get a ticket for $1. So it was Book the Bears night, and the basketball team and the athletic department was very good about that. So keeping the line of books is hard. The gently used books is a challenge. You have to stay on top of that. The new books, that's more of a challenge. As time has gone on, we've lost federal funding for Reach Out and Read from the Department of Ed. So it really is an effort on our part. We do have an ETSU Reach Out and Read account with the ETSU Foundation. So donors do make donations, and we've asked for that at times. But it really takes a partnership, and this is where I think it's helpful to have a person like me that's in the literacy world and is also trying to help Karen and the other pediatricians to keep that going, because it's a joint effort. That is the biggest struggle. And then once you get the books and you have them, physically storing them is another issue. Do you have room for lots of books? And physically getting them into the clinic, putting them in an order where you have books that are appropriate for 6 months old, and then 18 months old, and then 2 years, and easily accessible to your team. So there are challenges, but I would throw out there partnership. There is probably a teacher who you know that would be glad to help with this, or a teaching organization. So that's the place I would turn.
Yeah, I agree. Just finding people to partner with and being creative. And there's lots of ideas on the Reach Out and Read website. I have become the book lady for our clinic over the past decade or so. And I've actually been able to get very consistently books for about $1. So I think we average just slightly over $1 per book, and these are board books as well as books for older children in English and Spanish by using online sources, as well as going to local booksellers, and some of them have community programs that you can sign up for. So I've kind of learned how to find the bargains, but still really high quality books. I've done a lot of grant writing, so AAP Catch grants, that's a great option, and AAP periodically will have other grants. I've also written a couple of state grants for different things, and incorporate books into the budget for our Reach Out and Read program. And what we do in our clinic is we don't purchase a huge number and then have to store them. I kind of purchase them periodically when the shelves are starting to get low, and then just kind of restock. And we're now trying to rejuvenate some of our donation programs that Dr. Hale mentioned, to get more of our nearly new or gently used or even new books donated. So I think it's actually a lot of fun. We get a lot of joy from giving out books, and You know, one of my colleagues, Dr. Jayshankar, her son did a book drive at the middle school for us last year. And I mean, we ended up with hundreds and hundreds upon, you know, nearly new and gently used books from that book drive. So that was really helpful. And like I said, it kind of keeps us going because the kids, their faces just light up when they get the book. And I definitely agree. It just really builds great rapport with the families. Any other questions before we go to our cases? Okay, so our first case. So Jana is a 19-month-old girl who's new to your practice. She presents with her mother for a checkup. Her mother has Jana's younger brother Ian with her today as well. When you walk into the room, the mother hands Jana her cell phone while you talk. The mother reports that Jana can say mama, dada, hi, that, no, and dog. She likes to feed her dolls when mom feeds brother. She can follow simple instructions and points to get her mother's attention. She's been walking for about 6 months. She can take her socks off and feed herself with a spoon. When you give Jana her board book, she holds it for a few seconds, then drops it and goes back to the phone. Mom comments at this point that she hasn't had a lot of time to read with Jana since her brother was born. She also notes that Jana really doesn't like to sit still very long and prefers to run around and just won't sit still for a story. So a few questions for discussion. Any concerns with this patient? Other questions that you might have about the case or for mom? And what advice would you share with mom? Go back to the case. So any concerns that you have?
I'm assuming the cell phone issue is something that you see routinely? Yes?
Yeah, so cell phones. Yeah, we see it. We see it out in public. I definitely see it in the office too.
Yes.
It's a good way to keep kids quiet while the grown-up is doing something else. It's very effective.
And yet we know that no screen time is appropriate for children that are under the age of 2, right?
Right.
So the fact that mom gives it to her automatically and the fact that she retrieves it over having a book tells you that it's a very routine behavior.
Mm-hmm.
So how do you go about discussing with the parent, maybe it's not a good idea to use a cell phone? Replace that with a book?
I'd kind of wonder what strategies mom has been trying to use to read to her, like you guys were saying earlier. Does she feel like she has to read from the front to the back and read every word? Or what types of books is she trying to read? Are they kind of at a developmentally appropriate age? Or, is she kind of what strategies is she trying to read? Or does she feel like she has to, put in a really long time rather than maybe just like you guys were saying before, read a couple pages, when you have time, when the younger sibling is, when you're able to with the younger sibling.
And when I see that behavior, I always address the patient first. And if they've had a phone or an electronic handed to them, I say it's time to put those away. That's not what we're doing now. Even though I know the parent's trying to make it easier for us, that's in the ER or the clinic. We remove the phone and I engage the patient, even if it's a 2-day-old patient, before I engage the adult. And I can get a lot of information from that and then model that type of behavior, direct eye-to-eye contact, age-appropriate interactions and and that sort of thing. So I start from the beginning and just make it a rule that we can't have the phone in the clinic during this time. And that usually allows me to have that conversation, even in the ER when we're talking about not this stuff.
Well, and I think this is a great example of the unique platform that a physician has, because you are working with parents who maybe in their life do not have anyone telling them this is not appropriate, for not only for their own behavior of being on the cell phone instead of engaging with their appointment, but certainly the use of that to entertain their child. There's a lot of controversy in education about, is an e-reader as good as a book? But the fact is, we have electronics in our world, and we need to come to some agreement about the parameters of when it's appropriate and when it's not. So having a book on a phone and looking at it is very appropriate if you're still doing that responsive parenting of back and forth and talking about a picture and talking about what's happening in a story and getting a child to talk and seeing if they comprehend what they're looking at. But it's not appropriate to use as a babysitter. So I think, kudos to physicians for providing that etiquette, that instruction, that bringing to the attention of the parent of what's appropriate, what's not. Because I'm not sure in many parents' lives that they actually get called on that. Yes.
Well, and I think, I find that parents are really concerned about child's development and their language development. They want to do whatever they can to help their children develop well. So that's kind of a opportunity for discussion. And I love being able to model how to use a book during an encounter. Children who use books daily or share books daily with a parent or caregiver. Of course, this is only one point in time, but there's a difference. You can tell they immediately recognize the book. Their face lights up. They open it up. If they're a young infant, they may also put it in their mouth, and that's an opportunity to kind of point that out. And if they're holding the book upside down, or point out different ways that children of different ages might use a book, and that's okay. And we give infant board books so that they are a little bit sturdier and they can't eat them immediately. But sometimes oftentimes I'll start the encounter when I come into the room with a book. It's a great way to model how to use books, and a way to observe and make comments on how the child responds to the book, how she points to pictures, or words that she might use in a way to kind of praise the family. In this situation, I like Dr. Champney's suggestion for just kind of setting a ground rule. We don't use phones in the clinic, and hopefully that would help redirect the child's attention. And then I don't think I realized when I was a new parent how to use books with young children, and the idea that you don't have to have them sit and listen to the story from the beginning to the end. And you don't even have to read the story at all. You can use words to make up your own story. You can talk about the pictures. And so that's a point I try to make with parents. I also think a lot of parents they appreciate some information about screen time and how to place limits on screens. Like Dr. Hale said, they're ubiquitous. It's a struggle. It's a thing that all parents struggle for, but I think they really appreciate some tips on setting limits.
I think too that saying it in front of the kid really there's a lot of power there, because it puts some meat behind what maybe the parent has already said. Oh yeah, mom has said we're not supposed to watch this. Or the parent chimes in and says, see, listen, the doctor's saying you shouldn't watch this much TV. And I think that has a lot of power if you say it and you have it in a conversational sort of tone, a non-judgmental, this is information sharing kind of way that they do. And I don't do well child visits, thank goodness. But I do a lot of this stuff anyway in my interactions in the acute setting, because there's tons of opportunity to do that. So it's not just something that you do once a year with the kid. You can do it with every single encounter.
There's a good article, it's older, in The Atlantic from 2010, I think. It talks about the 32 million word gap, you know, and kind of the studies from researchers found in the mid 80s where they kind of counted the number of words kids had in different socioeconomic status households and found that by age 4, the kids from the lowest SES households had heard 32 million fewer words than the kids in the highest SES households. And they were using that to kind of say, you know, we don't just, you know, intelligence and literacy is not just about genetics, but it's about kind of that interaction with genetics and environment. And so when you're reading to your kids, that's expressing certain genes. When you're talking to your kids, that's expressing certain genes. And so, and that, you know, by the time they get into kindergarten, like you guys were saying, it's hard to undo some of that stuff if they haven't had a lot of that being read to or being talked to a lot. And so I think part of maybe the anticipatory guidance is you don't have to review that study, but, you know, just being able to talk about the importance of the early, like how early on this is important, and maybe helping parents understand kind of the rationale for why you would want to read these books, or look through these books, or talk about and create stories from these as much as you can, because it has such an impact on development, even if it is a kid that isn't talking yet, you know, and so maybe, I don't know, I was wondering kind of from Mark or Sarah, just practically in your all's practice, how does some of those conversations go in terms of the anticipatory guidance? Are people like, I'm always curious to hear how other people spiel, you know, about this with patients, and I learn a lot from that. So I wondered if you could speak to any of that.
I like to say, with all my developmental screens, to make a routine of brushing your teeth, reading a book, and then going to bed. And that they don't have to read the book. They can talk about the pictures or what's happening in the pictures, and not make it a stressful thing trying to finish the whole thing, but just talk about it and make it part of the routine so it's fun and engaging for the child. And for another thing I'll usually say is, just as a reminder, to sing to them and read to them and talk to them, help their language development, even from a young age, from a newborn age. I was telling that to mom with a newborn the other day. Just get in the habit of singing to her, reading to her, talking to her. And I do tell them to limit screen time, that we don't recommend it under 2. And then older kids, we recommend no less than 2 hours a day, or less than 2 hours a day, or none, usually how I say it. But it depends on the situation, exactly how it comes out. I don't tend to spend a lot of time on it because we've got so many other things to talk about in a well-child check.
Thank you for that, Sarah. I just want you to know, every time that you tell a parent that, to say, talk to, look at a book, talk about pictures, you know, have your preschooler draw the grocery list, you know, draw the milk. Even if you can't tell what the symbols are, you are teaching, parents can teach a child the symbolism for those marks on the page. It makes a huge difference for the kindergarten teacher and the 4th grade teacher and the 6th grade teacher and the 9th grade teacher. And I think that you have been unthanked for so long in doing that, and it makes a big difference, especially in our area where families need that support.
Well, I like the suggestion of the routine, because a lot of families, their lives can be pretty chaotic, and, you know, young parents can be pretty sleep deprived. So even giving simple suggestions for how to make it a daily routine can help them make sure that it happens. Mark, did you have anything to add in terms of how you talk to?
Well, I just encourage my parents to enjoy their children. A lot of times they get caught in the world of, you know, I have to figure out how to do this and that, but if they'll take the time to enjoy the reading or enjoy the interaction. You know, and reading is just one example of the parental interaction with their children. The other thing I do is try to, as you mentioned earlier, is set an example of how to interact in the exam room. when it's obvious that mom or grandma is stressed out about the child's behavior, especially if it's a little boy, and maybe they're trying to give them a phone or something, and I just encourage them that it's okay that they're active because they're full of energy, but it's how you direct that energy and guide that energy. A lot of times what I'll do is, especially my nurse will come and say, I hope you're ready for this one. I have several sets of twins that like to come in and have their exam at the same time, and the nurses are always worried that the exam room will be destroyed by the time we get out of there. I just simply take in a handful of crayons. We have white paper covering every bed, and I tell them to start drawing, and I tell them what I want them to draw me a picture of, and just redirecting that energy, and the parents seeing that it can be done easily without a whole lot of complication. If you can just, like you said, give them some examples of how to do it, the parents are real receptive to that.
And you can tell a lot about a child by how they approach that piece of paper with that crayon and what they draw, right? Yes.
So instead of them directing them to, make a certain shape or whatever, I'll say, draw me a bird or draw me a house, and maybe the shapes will be involved in whatever I ask them to draw, so they can enjoy what they're doing.
Excellent.
Well, that really does help the whole encounter go more smoothly. It gives you more information. So I love that suggestion. We have one more case to discuss, but I didn't want to get to the end of our time without mentioning the funding opportunity that we have. And Tara Chadwell had to get off the phone to go to another meeting. But Niswonger Children's Hospital has some funding from, can you take the picture away, Brian? Because I can't see my slide. Has some funding from the First Tennessee Foundation. And we were able to apply and had approval to use some of that funding to help support clinics in the region who want to establish a Reach Out and Read program. So we have funding available now to provide clinics with at least $1,000 worth of books to help get their program started, if they are interested in completing an application to become a Reach Out and Read site. And we're also, interested in helping if people have questions about the application process or really how to build and sustain a program. We're happy to talk with clinics about that. Dr. Hale kind of mentioned some of the things you've got to think about and have to start a program. If there's interest in this funding opportunity, my email and my cell phone number are on the screen. Please let me know. And if you have colleagues in other clinics that you think might be interested in this opportunity, please share it. Let's go to our last case, and it looks like his name changes from David to Jose on the 2 slides. Let's call him David Jose. So he is a 6-month-old boy presenting with his mother and father for a checkup. David will be staying home with his grandmother 5 days per week since his mom is going back to work. The grandmother speaks only Spanish. The father asks if this will delay David's language development. So how do you evaluate language development in children in bilingual families? How can you recognize language delay in children in bilingual families? And what advice do you have for this family about their son's language development? And I apologize for the numerous typos that are on this slide. It's always ironic when you're talking about literacy and they call these literacy errors. There's irony there. So what about Dad's concerns and spending time with the Spanish-speaking only caregiver? Will that delay his language development?
It may delay his English development. But if she's singing to him and reading to him and talking to him in Spanish, and then when he starts school, he should pick up on the English pretty quickly too. I try to reassure them quite a bit. If they are developing properly in Spanish and can speak Spanish words and are getting the words like they should be, then I don't worry about it too much.
My observation is that the biggest problem these children tend to have is they'll mix the languages until they figure out who they're supposed to be speaking what language to.
Right.
But generally, they tend to be as well, if not better, developed linguistically because they're getting multiple exposures of language.
I could be wrong about this, but I thought I had read somewhere where you can kind of count the number of words in English and in Spanish and combine them, and that would be a kind of a closer representation to see whether kids are delayed in their speech or not. But maybe you all can tell me.
I think that's true. And I give them credit for words they use consistently that may not be a word. So if they have a word for their blanket that they call it and they use that consistently, I'll say, well, we'll count that as a word if they're using it like a word.
There's always a lot of concern in the school system with children who are bilingual and concerned that they're not going to be able to keep pace with English and English comprehension. Some of the research is saying it depends on when English is introduced to them as a second language and how far along they are in learning their native language. But I've always cautioned teachers not to jump into saying that a child has a significant delay when we're talking about a child learning 2 languages. So I think what you're doing is excellent, very helpful.
I always make a point of telling the parents that it's important for the child to continue to keep that language, keep their Spanish. And then as they do their English lessons, to make them do it in Spanish too. I don't know how many actually do that, but I try to encourage them to do that so the child doesn't lose the Spanish. Because what I see is a lot of kids will grow up and then they'll maybe be able to speak some Spanish, but not be able to communicate fully in it because they suppress it. They only want to learn English. And they can't write it, and they can't really communicate in it effectively because they've wanted to adopt a new culture. So I encourage them to maintain that culture.
Yeah, so I like the idea of providing reassurance, but also sort of turning around as a positive, that David will have the opportunity to learn 2 languages and how wonderful that is.
And I think for the kid that's truly exposed to both languages at the same time, I wouldn't have concerns about delay. I would have the concern about him losing it later because he's not going to be educated in that language. But
Right.
It's the kids that speak one and then change.
That speak one language, and then a kindergarten entry is kind of their first introduction to another language that maybe struggle a little bit more. One thing I wanted to point out, this slide about the funding opportunity says it practices in Northeast Tennessee, and we actually did clarify with First Tennessee Foundation that the funding is not limited to Northeast Tennessee. It's really for the region. So for instance, if we have a practice in Southwest Virginia who's interested in participating, that's fine too. So I just wanted to clarify that about the funding opportunity. We looked at the Reach Out and Read website and know that ETSU Pediatrics is really the only existing active Reach Out and Read program in the region. And so just given that this is an evidence-based program, we've really enjoyed doing this program in our clinic. We thought that if there's a way that we can help disseminate Reach Out and Read in the program, that would really benefit providers and patients.
I had previously filled out the application and got approved as a site, but we have not pursued that further because we did our estimation of how many books we were going to need, and it came out to something like $12,000 worth of books a year, and that was just more than we could personally take on. And I did reach out to our local Rotary Club because I'm a member, and they said, well, we might be able to help you with about $200. And so I'm like, okay, at $275 a book, this isn't going to work for our clinic. And it kind of got dropped from there. So well, $1,000 worth of books sounds great. If we can't, if we have to do the $275 a book, we're probably not going to participate. But maybe we could just start collecting books. And I have asked for book donations from my local thrift store. They have some they just throw away. And so I said, well, why don't you start bringing them by? And I put them in my rooms, and I tell kids they can take them home. Sometimes I don't always let them or offer that, but I wish I had more. And we did it in my residency, so I know the program and I love it. But the financial part is significant for our practice anyway.
So Sarah, did you say you're in Abingdon?
Yes, we're in Abingdon, and we know we're available for your grant, but that's a one-time grant, and we have a huge number of kids we see. So, I would need to write grants and go talk to everybody in our community, I think, about this, and I don't have a lot of personal time to go put into that, and I feel daunted by that whole process. So I was really passionate about a year and a half, I think, ago, and did the application, sent the letter of commitment, because all our partners were willing to give the books out and do the training. But when it came down to the finances, we weren't personally ready to shell out $4,000 each to guarantee we could have books. And you had to have at least half the year's worth of books, but either bought or money raised before they would let me start the program in Virginia. Because the funding isn't going to come from the state here. It's going to be locally funded. And so that was a big block for us.
Yeah, when we started the program here, Dr. Tuberty and Dr. Hale, they did have a small grant from Target. We think that it's very likely or promising that this would not be a one-time grant, that we could probably have some ongoing support that we could provide. I know it does seem daunting, and I guess I didn't have that problem because I kind of inherited my role as being responsible for these books after Dr. Tuberty left the area. But like I said, for the past 10 years, have really been able to find books for more like $1 a book. I think that's really feasible. I'm happy to share any tips that I can. And, I'd say if you can get to that point where you have a plan for half of your books, I would say, try it and kind of see how it goes. And I think reaching out to partners in the area is a great idea. But I know it's a daunting task, and we don't have lots of time. But I guess if there's interest, we're happy to troubleshoot with you to help you get a program started and try it out.
Sarah, so I have just made some notes. The United Way of Southwestern Virginia, there are some ladies that work there that do a lot with early childhood that may be able to tap you into some teachers to see if they have books that they would want to donate to you from their classrooms if they're getting new. Mm-hmm. I don't know if you've looked at firstbook.org. So that can be a winner, or it can be a not so good. When Jessica Tuberty and I first started, you can apply to Firstbook. Those they gather books that publishers overly produce, and you just pay the shipping and you get the books for free. So we did that one year without realizing, and we ordered 11,000 football books. Do you remember those?
Oh, yeah.
And so they were all the same, and everybody in Johnson City and the surrounding area, everybody had a football book because we had so many. So you have to really be savvy about that, because they will list what the titles are. We just didn't pay close enough attention. We thought, well, $11,000 for this much money. 11,000 books for this much money. It's great, but they were all the same book. But you can sign up for firstbook.org. But this is where you get to needing a person like me that has time or has students who can do this.
That's absolutely right.
Yes. And then the other thing I thought about was United Way of Southwestern Virginia. They actually sponsor a spring early childhood conference on a Saturday. They may have had it already, but that's another place that you could appeal to them, that if people have books, because they realize that you are seeing families that they may not be seeing, and that you could provide that guidance for how to use a book, you will find that the early educators are very willing to partner with you. You just have to find the vein to tap into. And then I will also keep that in mind. ETSU hosts a reading conference, usually in June, and we have folks from all over come to that one-day conference. And they always ask me to come in and do my little song and dance about reach out and read. And I can actually tell them that if you want me to, that your clinic would take donations of gently used or new books, because we do attract early educators from Southwestern Virginia for that conference.
Yes, I'm happy to take those donations.
Okay.
Also, I've spoken with our local library group, and one of the librarians is trying to help me get a grant through the library, I think, to get books. Our Dolly Parton's Imagination Library here lost its funding, I believe, or most of it, through the United Way, because their funding was cut.
Yes.
And so asking United Way for money specific for this program isn't going to work. However, they have just started this new campaign called the Campaign for Grade Level Reading. I went to their promotional seminar on it, I guess, 2 weeks ago. And they're wanting everybody to read on grade level, of course. And so I promoted the idea that, well, maybe they could give me some books in my clinic.
Yeah.
And, they seemed interested in that idea and really wanted to partner, but I'm not sure what that would look like. And I haven't had any follow-up with them yet. So I need to do that. But I'm in the process of trying to get books, but the overwhelm, I guess, comes with the commitment to the Reach Out and Read program, where we're going to have so many books, half the year's worth of books up front before they'll send me any. And I mean, maybe I could do that pretty easily through some of these other ways, because my partners and I are willing to commit a little bit of personal money, but not $12,000.
Right. The other thing, Sarah, is that maybe you could tap into community colleges, any teacher, have like a book drive with any teacher ed folks. UVA-wise also used to have an elementary or early childhood conference, and something that they could do is say, bring a book, as part of your, I also, in the Center of Excellence, we host, this is just dawning on me, every year I have an annual early childhood conference that's 3 days. We have it in Kingsport. And one of the things I could do is have a book drive and sponsor a practice, because teachers love to buy books. Believe it, they love it. And if they think that they're going to give it to a needy child, that's something we could do. And I have about 1,200 people come to that conference every year.
Oh, wow. Well, I would love to have a storage problem. Right now I have a shelf.
Okay, maybe we'll work on that.
Yeah. Right now I have a shelf in my office that I put the books on, and I come and get one when I have a kid that I feel like definitely needs one. But I only have probably, a total of 50 books right now on hand, right, to give out. And the last time I tried to give one out, the kid didn't want it because he didn't like that topic. So I said, okay.
Well, Sarah, I am happy to bring you a lot more books.
Because ones I have are all used and
Any day.
beat up.
Yeah, I'm happy to bring you a lot more books.
Well, I'm happy to take them. And then, if I get enough books where I can say to Reach Out and Read that, we've got a lot and we can officially start again, fine. But if I can't, then just having them there to give out is fine by me, whether I get them through them or not. So I think it's an important thing.
Well, I think you've already taken some great steps and have had some great ideas for getting started. So, well, I just want to thank everybody for joining in. Thank you, Dr. Hale.
Thank you for having me. Good luck, everybody. Reach out to me if you need some encouragement or some help.
Thanks.
Thank you all. Have a great rest of the day.